So I want to talk first about the nature of conflict and what that means. Of course, this varies tremendously from context to context, and the local dynamics of conflict are very important. But as a global pattern, we're seeing that conflict is increasing. By almost any metric, the world is more insecure today than it was 10 years ago. And on top of that, we're seeing changes in the nature of that conflict. And those are two key changes that I think are important to highlight in relation to COVID response. The first is that we're seeing a greater localization and diffusion of lower intensity conflict. So more fragmentation, a higher number of often diverse conflict actors competing for space. In other words, that maybe conventional idea we might have had historically of a war being fought between two countries with regular armies fighting maybe over territory no longer holds true in the vast majority of conflicts we see today. We're seeing a huge amount of proliferation of violent actors and the really complex interplay between, I think, global geopolitics as the world becomes more interconnected, but also localized conflict systems. In other words, the more we study about conflicts, the more we see that even local conflicts, local violence that may seem to be totally separate from national level crises, that may be playing out over resources, over boundary disputes, over local political control, are often fueled by and in turn fuel national level crises. So we need to be attentive to those three scales, that global geopolitics, the national level, and also that subnational, very localized conflict system. The second point around the pattern in general conflict is the shifting norms in the protection of civilians. And I think we've all watched with horror the changing patterns of the targeting of civilians in conflict, the increased apparent impunity of actors in conflict who are targeting civilians, and the disregard in many cases in high-profile conflicts for conventions around international humanitarian law and customs of conflict. And both of those features are going to be really significant when it comes to talking about the impact on COVID response, partly because we see that interplay. The first is that we've seen health systems directly targeted. So the infrastructure in many of these contexts for health response has been hugely depleted. But on top of that, the fact that we're seeing more protracted and drawn out cyclical conflict means that the systems themselves, the staff, the capacity, the training, the investment in public health response will have been depleted, not just in the context of a short-term conflict, but potentially over decades. And I think cases like Yemen, where we're seeing things like cholera outbreaks and the inability of the health system to respond and to meet those needs in many contexts, really highlight that. There's an infrastructural issue around the targeting of health systems. There's an IHL issue around the fact that health systems and health workers have been targeted in some contexts. But really profoundly, there's a lack of institutional and systematic capacity that we need to be attentive to. And I think as a first instance, we need to think about what that combination means, structural destruction alongside those systematic deterioration of health capacity, and ask a couple of questions about our response. And those might center around, and there are many, how donors and multilateral organizations can address both immediate needs in this health crisis, as well as the more sustainable task of health system strengthening, particularly though not only in a context where we're seeing a withdrawal in some contexts from the multilateral system and a risk of that kind of self-interested response by member states saying we're going to look after ourselves and we're going to prioritize our own health systems, and maybe even competing with countries in conflict for PPE or for other resources. Also, I think for humanitarian response, the question becomes, how do we ensure that any response we build now isn't entrenching a parallel system, either for COVID response or for wider public health needs? How do we ensure that that doesn't undermine public health goods and public good provision more generally? And I think thirdly, the question that raises from a research side and also from a tracking and tracing side is, how can data be systematically collected in these contexts when that's so key to prevention, containment, treatment and recovery, if those systems themselves have been so deteriorated? What systems how can we pool our resources as responders and as researchers to really leverage the data that we can gather, limited though it may be, in order to support those efforts? The second aspect I want to talk about is how conflict affects social and political systems. And I think this is often a neglected or a sort of overlooked aspect of conflict's impacts and its damage, the damage it does in societies. research that we've carried out in South Sudan and Central African Republic with Concern Worldwide, who Don's joining from today, shows that the social fabric of communities is fundamentally disrupted by conflict. Trust, social cohesion, and really critically in the context of crisis, mutual support systems are undermined and deteriorate in the face of conflict and wider crisis. That means the ways that communities might conventionally help one another, neighbours or family members supporting each other with a loan of food, or by loaning money, or by supporting people in crisis, those are really, really profoundly disrupted. And that has an impact not just on people's ability to survive the current crisis, but also on their longer term coping strategies. So how can people recover from this crisis when indeed it does pass in ways that they haven't maybe engaged in coping strategies that have deteriorated that capacity over time. I think particularly we need to be attentive to the fact that when that social trust collapses or is destroyed, that divisions in communities, particularly where they align to existing divisions, to identity markers, and to perceptions that some communities might not be experiencing this crisis as severely, might be receiving greater attention, or might be receiving more assistance, or be prioritized in response, those can be hugely, hugely damaging. And I think we don't have to look very far to see that leaders around the world are already calling on some of those ideas of belonging, of otherness, of difference, of foreignness, and politicizing those in what can be really toxic ways. And the real difference when we think about violent conflict contexts is that those tensions are not beneath the surface. Those divisions are not under the surface. Those have already boiled over into open conflict. And those concepts of division and belonging or not belonging are already very clearly established. I think we have to be attentive to many of those divisions, but chief among them, as I see it, is the question about displacement. So displaced populations, conflict is producing tremendous numbers of displaced populations. We've seen the IDMC in its recent report estimating that internal displacement, those fleeing often conflict within the borders of their own countries, is at an all-time high. And because of the nature of the pandemic and the association of the pandemic with this idea that movement and travel and transit become conduits for and vectors for infection, displaced populations are particularly vulnerable. And when we think about how we respond to that, I think we need to be conscious of the need to identify those vulnerabilities and those risks that displaced populations are facing, but also messaging in a way that doesn't further stigmatize displaced populations or reinforce an idea that they are a particular risk. So thinking perhaps more broadly, following examples of models of a displacement affected population as a population in need, thinking about host populations, returnees, urban displacement, and trying to think about those categories a little bit more expansively so that we don't risk reinforcing any of those key divisions that are already so politicized and so potentially volatile in these contexts. I think another point to make about social capital, and it's one that sits a little bit uneasily or perhaps difficultly in a difficult way with some of these discussions, is that social capital doesn't entirely collapse in conflict. A good example, positive examples, we see that there is still solidarity between community members in crisis, and we see that the humanitarian response of first responders, those are overwhelmingly local and national humanitarian responders, as just one example. But on the other hand, we also see examples of that negative social capital, that kind of expansion of the role, the power, the control, and the coercive capacity of interlocutors or community leaders who can capitalize on a crisis. And I think we need to be very aware of the potential for that to happen, particularly as movement restrictions and restrictions on humanitarian assistance, for example, are introduced in the interests of public health. We need to be conscious that those interlocutors, those community leaders who we engage with, that we're doing so in a way that is truly impartial and that is not inadvertently strengthening the power of groups that might be exclusive, that might exert coercive control, or that might further inflame tensions or a perception of bias or differential treatment or support or assistance to particular populations. That brings me, I think, to my third point, which is around security actors responding. And again, this is very differentiated in different contexts, but if we think about a general pattern, we've seen all over the world that security sector actors have taken on some kind of role in COVID response. We've seen national militaries playing a role in everything from distributing or facilitating the distribution of medical equipment to quarantine and social distancing control and public order control. We've also seen, of course, non-state armed actors engaging in some of those functions, expanding their governance roles and actively taking on a role of public order maintenance and response in the current context. All armed actors, I think it's important to remember, now have at least the opportunity to expand their role in terms of coercion, control, and also in terms of their ability to I suppose, regulate and restrict movement and order. And I think that's something that we need to be mindful of, the particular dangers of that. We've seen already a number of heavy-handed responses by security actors. The UN has warned against excessive force in the imposition of movement restrictions or in quarantine provisions, for example. We've seen in past global health crises the targeting of health workers and facilities, not only by armed actors themselves, but also by wider communities, for example, where that social compact and that level of distrust with authorities has broken down. And I think we need to be mindful that that's happened in Ebola response, it's happened in polio response, that we've seen health facilities and health services targeted in conflict contexts in a way that is very different and unique to some degree in conflict contexts. We're not seeing quite the same level of targeting and that level of risk in more stable contexts. So that's an added risk. In Cote d'Ivoire, only recently we saw an attack on a COVID treatment center, or a proposed COVID treatment center, by demonstrators, suggesting that there is potential for similar kinds of dynamics here if those relationships, that issue of social trust and authority, isn't managed carefully. And I think that is what's a sort of a step change when it comes to conflict contexts. We're talking about areas that have a huge amount of fragmentation in terms of authority. Many of these contexts might have areas that are not under government control entirely, or they're contested in terms of their control. And that can have an impact on movement of people in and out. Again, to think about displaced populations fleeing violence, as they have a right to do under international law, and seek refuge. That can be hugely detrimental to their ability to do that. Humanitarian assistance can be restricted in those contexts. But we're also seeing now the risk that the information that's coming out of areas that are controlled maybe by non-state authorities is politicized, it can be contested or resisted. And there's a question there about information management, about how do we ensure that data on tracking and tracing, for example, that's so crucial to containing the pandemic, is both credible, but also seen to be credible when it's in contexts that are highly fragmented and highly contested. Those are, as I said, mainly questions and queries, and something I hope we can discuss a little bit more in the discussion and Q&A afterwards. But I suppose if I were to zoom out and think about recommendations or key areas to focus as I conclude, I think in terms of advocacy and policy, the changing nature of conflict and shifting norms in protection and targeting of civilians is incredibly important in terms of our engagement on the global scale. We are at risk of the progress that we have made in things like the Global Refugee Compact, the Women, Peace and Security Agenda, momentum around the prohibition of the starvation of civilians in conflict. We're in risk of those progress in those areas being undermined and rowed back on. We also have an opportunity, though, I think, to say that given the seemingly unprecedented nature of this crisis and the importance of stability and of being able to access populations, that rather than row back on those, and rather than see the international community retreat from them, or even try to hold a defensive position of not ceding ground, that we can be more ambitious and say, actually, we want to see an advance in this. We want to see advances in the protection of civilians and the accountability measures at this time, so that we are not seeing what might be emergency measures in the short term become cemented as the new normal in terms of restrictions on movement, the neglect or isolation of women, and considerations of gendered violence, for example, and issues of IHL going largely unchecked, as they have in some contexts. I think operationally, it means drawing to a greater extent on what we already know around community dynamics. So making sure that in our data collection and in our responses, we're also taking into account social tensions to make sure that we have conflict-sensitive responses that are not further entrenching divisions or inflaming tensions between populations. And I think in terms of security sector response, the key lesson here is that some of this may be uncharted territory, but some of it we do have learning from past examples. We've seen in Ebola response, for example, that there are some functions that security actors can perform, typically in terms of the lessons that came out of that around logistics, around construction, for instance, of health facilities, that appeared to add huge value. Whereas there are other functions that if they are performing them, and particularly if they perform them in a heavy-handed way, they're not only not adding value, but they are at risk of undermining the response in its totality, of inflaming tensions or aggravating a situation that actually makes spread more likely and containment more difficult. So navigating, I think, that balance between issues of social trust and where and what particular role a rights-based security response should be is another area that I think operationally we have some research, we have evidence, we have learning from the humanitarian response there, and we need to be drawing those out, I think, much more clearly. I'll end there, but happy to take questions in the Q&A, and looking forward to my co-panelists building on some of those points and sharing some further detail. Thanks.
Well, thanks so much, Caitriona. That's absolutely fascinating, and I can see we have our work cut out for us even before anybody else has spoken, and I'm sure a lot of the other speakers will be echoing the points. And so important to recognise the interaction between all of those variables. That these things don't happen. People don't live their lives in silos. That we're basically looking at the interaction between politics, economics, health, social systems, and the conflict dynamics themselves. By the way, just so that people are aware, we are recording this session, so that it can be accessed later. Are there any immediate questions or clarifications that are sought? We don't need to take questions now, but in case anybody was dying to get in with something very brief, just give the opportunity now. Either use your microphone or on chat. I have chat open. No, okay, that's great. Well, look, let's move on to the next contribution. And Concern Worldwide is an organization that has been working in conflict-affected and fragile states around the world for many years, has responded to Ebola, and is now dealing with the realities of responding to the implications, some of which we've heard about, of COVID-19. So to take us through that is Concern Worldwide's Conflict Policy Advisor, Dominic Hunt.
Hi everybody. I hope you can hear me well. I'll just share my screen with you in the hope that this works. Okay, so my name's Dom Hunt, the Humanitarian Policy Advisor for Concern Worldwide, and I do focus on conflict and conflict sensitivity. What I'd like to talk to you about today is looking at COVID-19 and the impacts of the pandemic and the way that we manage the pandemic on conflict. So looking at it as a threat multiplier, and then secondly, to look a little bit about how conflict can be an obstacle to a COVID-19 response done by humanitarian actors, or indeed anybody else who's trying to control the pandemic. So first of all, just to look at the threat multiplication, the idea of threat multiplication is that we don't necessarily think that COVID-19 will directly lead to conflict, but we do think that it would be one of the many issues that can contribute to increasing conflict dynamics and therefore exacerbate a situation and either make existing conflicts worse or more complex, or indeed contribute to the starting up of some conflicts, maybe in some parts of the world. So the idea of threat multiplication, much as we talk about climate change, so not a direct causal link, but a contributing factor. So first of all, just to look at the economic issues around how we have been controlling the pandemic, and indeed obviously, as we all know, this is the lockdown mechanisms which have been put in place now in large parts of the planet and the economic fallout of that. And obviously, there's a widespread loss of livelihoods. And if you are extremely poor, if you rely on day-to-day earnings in order to eat, or if you work for a very marginal small business which has now gone out of business because it's not allowed to operate, then you lose your income and you start to struggle for survival. So we do think that the combination of places which are densely populated, so urban areas, with extreme poverty and with weak services are really sort of flagged as being flashpoint areas for where this is hugely problematic. If you remember back to 2007, 2008, we had price spikes of essential commodities around the world. And if you remember, these resulted in riots. And there were a number of riots around the world. I remember there being violent riots in Cairo, in Haiti. And indeed, this has been one of the underlying causal factors of the Arab Spring. And we are already seeing price spikes. We are seeing protectionist policies where some countries, instead of exporting food, are preferring to keep it within their own boundaries and provide it to their domestic market. And for a country which is reliant on importing food, like South Sudan, for example, then inevitably the price of food will go up. And for the extreme poor who rely on accessible foodstuffs, this of course can be catastrophic to their survival. And then, of course, there are enormous numbers of people who are already dependent on humanitarian aid, and refugees and people in internal displacement camps, or people who are already in contexts of conflict and who rely on the provision of humanitarian aid for their survival. Where that humanitarian aid starts getting scaled back, or it becomes problematic to provide it, or indeed that it becomes more and more expensive for the humanitarians to deliver that aid, then again we have this storm of issues which are coming down the line, or in fact that are already here. So the economics really desperately needs to be flagged as being a hugely problematic element of how we're controlling the pandemic around the world. Now, I want to come back to that later on, but something that Caitriona was talking about, the social issues with regards to the pandemic are also hugely important. So people are frightened of the pandemic or of the consequences of the pandemic. People are stressed by it. We can't deny that the emotive mass media and social media, fake news, gossip, lies and just rubbish which is being heard, all contribute to increased levels of stress and fear. People being locked into their houses together, we're already seeing that there is roughly an increase in something like 30% of gender-based violence and domestic violence, just as a result of people being stuck together in conditions of fear and stress, and people not being able to get away from these dangerous conditions, and the loss of social cohesion. So, Caitriona was talking about social cohesion being one of the things that does get heavily affected in conflict contexts. And of course, at the moment, we're all isolated and we're all forced to stay at home. Social cohesion, arguably, is one of the things that we desperately need at the moment to be able to get through this with a decent amount of mental health. And the social distancing is disrupting this. And now it's all very well and good for us with access to social media and telephones and what have you to be able to chat to each other and to maintain our social networks. But if you can't afford it, then how do you maintain social cohesion under lockdown context? Alongside this, of course, there's also the rise of discrimination. Now, we are seeing, for example, that the pandemic has been racialized by the President of the United States, for example, but also down at the local level and within some of the countries where we live, people with white skin are being blamed for bringing the pandemic into the country. The first 4 cases in South Sudan were 3 European origin UN workers and the driver of one of them. And these were the first 4 recorded cases. So inevitably, the South Sudanese are now blaming people with white skin for bringing the pandemic into their country. And this leads to patterns of discrimination. We've also heard people of Asian origin being targeted and discriminated. And this is the othering is, I suppose, another area where we need to be concerned. The politics around the pandemic and around how we manage the pandemic, there is a significant amount of concern about how repressive regimes may use lockdown for controlling dissent. I'm actually talking to you from Beirut in Lebanon, and at the beginning of the lockdown process here, they closed bars, restaurants, shops, and told everyone to go home. And then the step two was they implemented a curfew, which actually doesn't have any value when it comes to controlling the spread of the virus. What it does do, or what it might do, is control the spread of people at night and therefore control criminality. But actually, on the very first night of the curfew, the government went and dismantled the protesters' tents in the centre of the city. And, you know, it was kind of a bit blatant, really, that one of the things that they wanted to do was to try and control dissent. We've also seen a lot of reports of overly strict enforcement of lockdown rules. You may have seen people in India being publicly shamed for being in the wrong place at the wrong time. There've been, you know, somebody got shot in Kenya for being out on the streets. And again, this causes a reaction by the people and a perception that the security forces who are implementing the lockdown rules are being overly strict and overly zealous. Now, where you have existing conflict dynamics, and already where the governance is weak, where the institutions are weak, and where the services that are provided are weak, then it's not surprising that we are concerned that these existing dynamics are going to get worse. And especially in a lot of the context where you work, where there is little or no investment in social protection. So as people get poorer, as people lose their jobs and their income, there's in Western and rich countries, then we do look to the government to provide us with some kind of safety net or some kind of support to help us get through the lockdown. But in many of the countries where we work, it simply doesn't exist. And when you put that against health services, which are often appallingly bad or indeed absent. I mean, Central African Republic has 3 ventilators for the entire country. So, you know, let's see what happens if and when the pandemic starts to spread in Central African Republic. And it's just one of many African contexts where there simply are not enough ventilators to go around. There's also concern about the use of the lockdown as an opportunity to attack while everyone's distracted. We're in Ramadan at the moment. In Afghanistan and Somalia, we are already used to and already expect there to be an increase in attacks during Ramadan. It's kind of like the Ramadan-related attack pattern. And so here we are in a much more unsettled context and in Ramadan. And would some of these armed groups take the opportunity to attack while everyone else is distracted? Quite possible. At the same time, of course, the people who would mediate, or the diplomats who would try and negotiate settlements, are also caught in the travel ban. So they're also not able to go to these countries and to undertake their work. And then we have the blame game. So, you know, the USA versus the World Health Organization and China. Watch this space and let's see where all of this goes. Now, taking all of this into account, I do think that there will be, and there already are, an increase in angry, hungry, and jobless people around the world, and that this may well result in popular uprisings that can become violent, an increase in criminality, an increase in armed group recruitment. Just an example on that one, Boko Haram was saying that because they are pure Islamic people, that they are not going to get sick from COVID. Now, if there are people in the wider population who believe that and then think, well, let's go and join Boko Haram, this is indeed a recruitment opportunity, and also recruitment into gangs as a way of ensuring your livelihood and your earning capacity. So angry, hungry, jobless people on the streets, we need to recognize that this is or could be a significant driver of conflict moving forwards. And I do think, as one of my major advocacy points from Concern Worldwide, is that we need to recognise the loss of livelihood and food insecurity as a conflict driver, and therefore we need to address it. So as a humanitarian community, we really need to focus our responses, obviously on health, because it is a health emergency, but also on food insecurity and the loss of livelihoods as a way of trying to avoid conflict arising as a result of the pandemic. Now, I've been talking about a bunch of fairly sort of depressing subjects, but there are some spots of brightness in all of this as well. So the global ceasefire that was called for by the UN Secretary General has actually been signed up by quite a lot of countries. So you can see on the map, all of the yellow circles are all countries which have publicly supported the ceasefire. The little love hearts in brown are actually where there has been a ceasefire called as a result of the Secretary General's request. So you can see that there is something which is positive coming out of this largely scary situation. And on top of that, maybe there is some room for some cautious optimism. So, you know, the big players, the ones that have lots of money, the ones that sell lots of guns to everybody else, are at the moment focused on their domestic issues. So USA, China, and Russia, they're all, you know, economically struggling, just like we all are, and they're all needing to look internally. Are they distracted from contributing to conflict around the world? I hope so. At the same time, because they need to be putting money into their safety nets within their country, then are they therefore reducing their military expenditure? Again, I hope so. And thirdly, as people in the military either are at risk of getting sick or indeed are sick, then that will probably reduce their military capacity. So we've already heard, for example, that the American troops in Afghanistan have been confined to barracks, and we've also all seen what happens on their aircraft carriers and other, you know, naval ships when, as they get COVID onto the ship, then lots of people can get sick. So there may be a reduced military capacity. And alongside the reduced military capacity and the expenditure, would we also see reduced intervention by outside forces into existing conflicts? So in other words, the third countries getting involved in conflicts in other countries, like let's say in Syria. So these are all sort of areas where we can be cautiously optimistic that there might be some reduction in conflict as a result of the pandemic. So as a conclusion there, I think maybe that interstate wars might decrease, but that smaller or internal conflicts might increase, and which of course is exactly something that Caitriona has just been talking about localized conflict systems and how these are getting, you know, more complex, more frequent, and indeed just the incidence of violent conflict is actually going up. So Concern Worldwide works almost entirely in conflict contexts, and we have been doing so for more than 50 years, and we have lots of experience of what it means to work in conflict. So how do we address conflict? How do we address COVID-19 in conflict context? To be honest, working in a conflict context is just simply more difficult, and regardless of what you're doing, whether it's a health intervention, a livelihoods intervention, or any other kind of intervention, it is just harder to work in a conflict context because people are already deeply vulnerable as a result of the conflict, because you have people moving around, displacing because of the conflict. We need to find them in order to provide assistance, because conflict seriously affects food production systems, and so you almost always get significant increases in food insecurity. Conflicts also lead to and often arise from contexts of extremely weak governance and poor access to services, and so there's this negative feedback loop that happens, and people are faced with insecurity because of the conflict, and we as humanitarian responders are also faced with insecurity because of the conflict context. So responding to COVID-19 anywhere is not easy, but in a conflict context, obviously, is just significantly harder. Now, you will see that the vulnerability, the displacement, and the food insecurity, and the poor access to services are things that I've already talked about as drivers of conflict. So I do think that, you know, as COVID-19 will exacerbate some of these issues, then I do think that we can get these negative feedback loops, and that everything, you know, that the conflict can get worse, as well as our issues in addressing the pandemic. just to put all what I'm saying into context, the global humanitarian context at the moment, again, something that Caitroina said, we have the highest numbers recorded ever of displaced people, of internally displaced people. So more than 50 million people internally displaced. And the majority of these are displaced as a result of conflict. And on top of that, we have close to 26 million refugees. So these people who displace over an international border and into another country. So the largest amount of displacement that humanity has ever been faced with. At the moment, the UN is estimating that we have something like 180 million people who require humanitarian assistance. WFP, the World Food Programme, is saying that if we don't do something about the global economics, we may be faced with an additional 265 million extra people in need and in need of humanitarian assistance. And this is at the time where the amount of money that we have in the system is clearly limited, where donor governments are obviously not really willing to give the money to other countries when they have such pressing needs within their own country. And to give you an example of that, the Global Humanitarian Overview, which is in this month, in April 2020, has only been 6.2% funded so far. On top of that, remittance transfers are significantly reduced. Now, the value of remittance is much, much greater than the amount of humanitarian aid. It's hugely important for people who live in context, in conflict contexts, where they send family members to normally, you know, richer countries like Europe, for example, who are able to work and then who are able to send money back to their families and to support them. But if the migrant workers are not able to work, then how do they send the money back? And so we have, in some countries, 70 to 80% reduction in remittance since the pandemic started. So how are we adapting to COVID-19? Some of this is by choice and some of this is because we don't have the choice. So we need to repurpose our budgets. We are not just getting extra money from the donors or to scale up our responses to COVID-19. We have to shift money from existing responses into COVID-19. And that means that some of the things that we were doing before the pandemic started, we are no longer able to do. At the same time, in many of the countries where we work, schools have been closed by government decree, and that would include child-friendly spaces. Now, in northeast Syria, for example, where children desperately need to be in school and where they get moments of safety in child-friendly spaces, and that these places are no longer open, this of course is of huge concern. We have to reduce or indeed cancel community gatherings, so our ability to interact with community members and to really understand what's going on is significantly reduced. We are trying to telephone them, and obviously this is much, much more difficult. And in many places there are no mobile phone networks, and there are limits as to what we can do. In a lot of countries, we're still able to do distributions, but with social distancing, so they take longer, they're much more difficult to organize. And for the moment, we're able to focus on cash. For the moment, markets are still working. We do expect some markets to become less and less viable as prices spike, as imports become more and more difficult, as internal transport systems become more and more challenged. And so we might need to consider moving to distributing food. But for the moment, we're trying to focus on cash because we would like to keep the markets functioning if at all possible. And then finally, I'd like to talk a bit about the flexibility. So, I mean, COVID-19, or if you get it, of course, you might die. And as it spreads through a population, there are obviously going to be people who are sick or desperately sick or dying. And we want to try and stop that. But the economic and food security consequences of total lockdown, as the Europeans are doing, arguably could actually kill more people. And if WFP is right, that there's a significant number of additional people in need of assistance, and where money is increasingly challenging to find, then we are increasingly worried about how a inflexible lockdown is actually going to be possible in some of these conflict contexts. So there's this new concept that we're talking about in concern called flex down, which is where you lock down and unlock populations based on what the disease is doing in the population, so how the virus spreads through the population, but also based on other needs, like economic needs, for example. And so you flexibly lock and unlock portions of your population based on epidemiology and based on other pressing needs, in order to try and control the pandemic, at the same time try and control some of the economic impacts of it, and to make the idea of lockdown as pro-poor as possible. Now, this is extremely difficult, and I don't think that anyone really is in a position at the moment to say it should look like this. So what we need to do is to go and talk to the people who are the vulnerable people and ask them how they think a lockdown can be done in their context, and to see whether it works. So as a conclusion, the capacity for us to deliver quality programs and to address humanitarian need is eroded, not only by conflict, but also by the pandemic. And so these two are working together just to make our lives significantly more difficult. And I will end on that note.
Great. Well, thank you very much, Dom. That's sobering. Not that we needed to be further sobered, but very interesting, and sadly rings true. Again, the way those factors interact, sometimes in ways we hadn't anticipated, is one of the key issues. We're very slightly over time, but there was one question has come in relation to the map around the ceasefires, which were declared in response to the UN Secretary General's call for universal ceasefires. Nadine is asking, what do the blue circles with quotation marks refer to in the map? If you'd like to share your screen again and go back to that.
Sorry, I'd muted. Okay, yes, I will do that. The blue circles are multilaterals. So let me just find the map again. Here's the map. Okay, so, okay, let's go back to the beginning.
Yeah.
Oh, there it is. Okay, so the blue circles. So this one here is the United Nations. This one here is the European Union, and this one here is the African Union. So they've also put their support in. So multilateral bodies. And then again, the yellow ones are countries, and the little love hearts are where the ceasefires are actually in place as a result of the Secretary General's call.
That's great. Thanks very much. That's one of the most positive things out of the presentation. I wasn't aware there were so many ceasefires that were actually being respected so far as a result. And one other quick question has come in from Zainab in DCU, saying, how do humanitarian workers protect themselves from catching coronavirus and making sure that they're not spreading it on to other people?
A very good question. I mean, the way that humanitarian workers who have to be in contact with others protect ourselves is much the same as everyone else. So wearing a mask and hygiene. So washing your hands as much as possible, making sure that you know how to cough and sneeze, and making sure that you're reducing both the ability to breathe in infected aerosol particles in the air, or to spread them to somebody else. Now, we're not a clinical organisation, but we do nonetheless work in health centres. So we work, for example, in nutrition or in health support system strengthening. And so it is perfectly possible that some of our workers will come into contact with infected people. So as I say, it's face masks, it's hand washing.
Great, okay. Which is the same issue that has been faced by health workers and nursing home staff in all kinds of contexts. Just because of time, I know there's another question's come in, but just because of time, I know we want to keep it interactive, but we also want to make sure everybody gets a chance to make their input. We'll move on to the next speaker. Thanks very much, Dom. So Caia Vlieks is a lecturer and researcher at the Tilburg Law School and lectures on rights, on constitutional law, and on migration at the Department of Public Law and Governance in Tilburg University. So Caia, please take up your opportunity.
Yes, thank you very much for the introduction, and thank you also for inviting me to this webinar. And hello everyone. I hope you're all doing well, even though these are extraordinary times, of course. It's a pleasure to be here today. And just to clarify, besides my work at Tilburg Law School, I also work as a research and education officer with the Institute on Statelessness and Inclusion, which is the first and only human rights NGO dedicated to working on statelessness at a global level. And also I teach a course on statelessness, nationality and protection of stateless persons in the Master on Refugee Protection and Forced Migration at the University of London, which is a distance learning program. Today I'll be talking to you about the issue of statelessness, focusing in particular on the impact of COVID-19 on the stateless and why is that interesting in a conflict situation. The issue of statelessness is already about othering other people. Which often causes conflict, and statelessness is an issue that can not only cause conflict, but is also sometimes a consequence of conflict. So that is why it is interesting, and I think it will also bring the discussion more down to affected populations. So I hope you find this that it complements the other discussions and presentations. So, as I assume that not all of you are all that familiar with the issue of statelessness, I will first explain a little more about it and what it means when you're not facing a global pandemic before turning to the consequences of COVID-19 for stateless persons, developments that we're already seeing, as well as some recommendations in how to address these. And I will conclude with some reflections on what is needed to address statelessness in relation to COVID-19. So let me start first with the issue of statelessness. Now, in international law, statelessness is defined and it is officially defined, and a stateless person is a person who is not considered as a national by any state under the operation of its law. To be stateless is thus be something that's different than being a refugee or being a migrant or being an internally displaced person. It's not about being persecuted, it's not about crossing borders, it's not about fleeing a certain situation. It is about the formal and legal absence of any nationality. In short, stateless persons have no nationality whatsoever. With that often come extra vulnerabilities, which include them being stateless in a migratory context, which can mean that they're also refugees, which can mean that they're also internally displaced persons. But statelessness as on its own is about lack of nationality. From then a very formal and legal perspective, it would seem that statelessness is entirely preventable and solvable if proper laws were enacted to address it. However, we see that today more than 15 million people remain stateless, and every 10 minutes a child is born stateless. As I already mentioned, statelessness is an issue that can be a cause and a consequence of conflict. First of all, large numbers of stateless persons within a country can be considered by states as undesirable because it could potentially destabilize the system of states and societies of citizens that we've built. It can create or worsen international tension and disorder and can even result in conflict, both internally and externally. On the other hand, we've seen that where some kind of conflict exists, for instance, between different ethnic groups within a country, those in power often resort to measures to deprive opponents or people that they consider others or people of the wrong ethnic group to deprive them of nationality, making them stateless. And the plight of the Rohingya in Myanmar is but one example thereof. So the causes of statelessness vary. Statelessness is most often caused and perpetuated by discrimination on various grounds, such as race, ethnicity, gender, disability, and socio-economic status. Statelessness can also be the result of citizenship stripping, carried out often in the name of national security, but often targeting political dissidents and human rights defenders. It is also possible that statelessness is actually inherited, so that it's passed on by parents to the next generation. Statelessness can also be a result of conflicting nationality laws, but also of state succession and decolonization. The collapse of the Soviet Union and decolonization both led to mass statelessness, for instance. And finally, statelessness can be caused or perpetuated by problems with or lack of documents proving your legal identity. Statelessness in non-pandemic times already has a severe impact on people's lives. And I could say a lot about that, but the words of persons who are actually stateless speak much louder. And I would therefore like to read a short story of a stateless person to you. And this is about the situation that this person was facing before the pandemic already. So this is the story of Isa. And Isa was born in Kosovo in the former Yugoslavia. He fled to Belgrade following the 1999 conflict because he lacked any identity papers. He was never registered as an internally displaced person. His very first document, his birth certificate, was only issued in 2013 when he was 29 years old. To this day, however, he remains stateless as he cannot inherit his nationality from his father, who is also stateless, or from his mother, who left him when he was only 2 years old. As a consequence of his statelessness, Isa cannot get married, have the paternity of his children recognized, or visit his family in Kosovo. Isa faces destitution because he cannot work legally, receive social assistance, or register for health insurance. He lives with his family in an informal settlement, which is an improvised barrack made of wooden planks, boards, and various waste materials, without water, electricity, or sewage. At the same time, however, he can also not apply for social housing, and he describes feeling like he has never existed. His only option at this point is to try to naturalize as a Serbian citizen to have some of his rights recognized. However, without the proper documentary proof of residence, it will be very difficult for him to fulfill this requirement. And as such, he remains stuck in a vicious circle, facing life in limbo. This testimony was collected by Praxis Serbia, which is a local NGO working on issues of statelessness for a broader network that exists, which is the European Network on Statelessness. And what Isa's stories, I think, does very well is illustrate how stateless people without a nationality do not have the same protections as individuals who do hold a nationality. Stateless people are vulnerable to discrimination and unequal treatment. They are denied access to education, healthcare, housing, employment, social welfare, as well as documentation, and are often unable to own property, to travel, and in general be safe, free, and equal to participate politically and have their voices heard. So being stateless in itself already presents quite a lot of problems, and I think speaks very clearly to severe vulnerability. What does it then mean to be stateless in the context of a global pandemic? Of course, during this global pandemic, we are facing an invisible danger and no one is unaffected by it. I mean, you are obviously also being affected by it. I'm also affected by it, but some of us are better able to protect themselves from the virus and its knock-on effects, while others face disproportionate risk. Stateless people are vulnerable both in terms of health risks and the social economic ripple effects. Nationality, that what stateless persons lack, acts as an enabler right or a gateway for the enjoyment of other rights and of state protection. I'm going to consider different rights and situations in that regard after one another, discussing how they affect stateless people and where possible also making certain recommendations on how we could try to address these. So one of the issues, obviously, that stateless people face is healthcare. Most healthcare systems are based upon nationality, meaning that if a stateless person falls ill, they cannot access healthcare in the same way as a citizen. They are likely to be denied treatments or face huge costs that they can simply not afford. Testing and treatment are both essential to stop the spread of COVID-19, as we know, but again, stateless people are likely to be denied both. It is therefore recommended that states should immediately lift restrictions on access to healthcare based upon citizenship or legal status. And some countries have already taken initiatives in that regard, and I'm giving one example, which is Malaysia. This is a country which has a large stateless population, but it has announced that it will include everyone, even those without documents, in testing for COVID-19. The UN has also urged other countries to follow these types of examples. However, we've had reports at the grassroots level that show that despite government assurance that all persons, regardless of status, are entitled to COVID-19 treatment, stateless people are still apprehensive to come forward because they're afraid that if they come forward, they will face certain consequences, such as being detained because they have no documents or legal status in the country. So this demonstrates that even in countries with inclusive responses to COVID-19 in terms of healthcare, stateless people remain extremely vulnerable. Now, one point that was already also touched upon by the speakers before me is livelihood. So stateless persons often work in the informal economy and rely on daily wages to support themselves and their families. But in many countries, including Jordan, Malaysia, and Nepal, we see that stateless people are being excluded from state relief and economic packages, which denies them the essential support for basic survival during this crisis, which has devastating consequences. A few days ago, a Nepali activist that our institute is regularly in touch with actually sent us a very desperate message. She was in touch with 40 families that are actually facing starvation because without citizenship cards, they are unable to access government relief. It is therefore very important that stateless people and undocumented persons are included in any economic stimulus packages and that they are able to access immediate relief. One further thing that I want to highlight, and that relates to the example of the stateless person I presented earlier, is living conditions. Many stateless groups are also refugees, living in crowded refugee camps or in informal settlements like ISA in our example. And in these camps or settlements, there is no way to social distance, and there is limited or no access to hygiene facilities, soap, or clean water. Stateless persons are also at a higher risk of being placed in immigration detention due to the lack of documentation, and in potentially crowded conditions in those detention facilities, COVID-19 is likely to spread extremely quickly. As a result, I think it's very important that authorities ensure that healthcare and hygiene facilities are readily available to all persons in camps, that food and essential items packages are distributed to people in camps and informal settlements, and to immediately release people from immigration detention to stop the spread of COVID-19. One of the things that we've also seen in response to COVID-19 is border closures. And many of these border closures mean that stateless people are unable to return to the country where they live, work, or have family. And this will have an unprecedented effect on their livelihoods. We are seeing that people are being denied entry to countries. And for instance, on April 16, we heard the tragic news of over 60 stateless Rohingya dying at sea because they were denied entry to Malaysia over COVID-19 concerns. So states are also using, or perhaps the better word is abusing, the current situation to further exclude those who are vulnerable and in desperate need of help and protection. One point that was also already highlighted by the other speakers is the greater risk that exists for women and girls. And that's also true for stateless women and girls. One of the things that has been highlighted specifically in this regard is that those who have been economically devastated due to loss of livelihood, as I mentioned earlier, that girls of those families might be forced into marriages with other families in order to actually get some money. There's also greater risk of gender-based violence And there's also one other issue which specifically relates to statelessness, and that has to do with countries who have used solely nationality laws, meaning that nationality is acquired through birth upon the territory. Because border closures can mean that mothers are forced to give birth to a child abroad and then are not able to confer nationality upon their child, which is creating statelessness effectively. And that is something I think that states should also be aware of. So states should not only be aware of the increased vulnerability of women and girls during this pandemic, but they should also allow women to confer nationality to their child on an equal basis with men, especially to children born overseas due to the COVID-19 pandemic. With emergencies laws being drawn up globally, there are particular worries that human rights will be sidelined and that measures will be discriminatory. As I hope I've already made clear to all of you, stateless people are often already discriminated against, are often already living on the margins of society, are often already considered as others, and the COVID-19 situation is only intensifying this. So therefore, even in these times, I feel that states need to stay committed to their human rights and humanitarian obligations under international law, including equal treatment to ensure human rights for all, even those without a nationality. The bottom line really is that stateless persons are more vulnerable than ever. Without nationality, they are often denied access to healthcare and a range of other social welfare services. And with an estimated 50 million people stateless worldwide, it is necessary that we have an effective response to that that's inclusive. So apart from the recommendations and notes I already made on how to improve the situation of stateless persons in the context of COVID-19, I think there are a couple of other things that are important to highlight in that context. One thing is that we need more information. Where are
could I just break in here just to mention we're a little bit tight on time, so
I'm wrapping up.
You're wrapping up. That's terrific. Thanks very much.
I'm wrapping up. I promise. Yes. So what I just really wanted to say really quickly is there's two things I think we need to be very aware of. One thing is that we need more information. So where are stateless people being left out or impacted by COVID-19 mitigation efforts? And the Institute on Statelessness and Inclusion and partners are already trying very hard to gather this information. And if you want to learn more, please visit our website at institutesi.org. Another issue that we've seen is that COVID-19 obviously doesn't discriminate, and neither should our response. Unfortunately, there's so far been a distinct lack of advocacy for stateless people at the international level. So not all stateless persons are also refugees or migrants, as I mentioned. And that means that the fact that often migrants and refugees are focused on in international at the international level, it is essential that stateless people are not forgotten. They must be recognized as a group that overlaps with, but at the same time is very distinct from other vulnerable populations who may be in need of extra support facing this global pandemic. I'm wrapping up definitively now, and I would like to end on a positive note, borrowing from a blog of a colleague that reached me earlier this week. And it concerns a large stateless population in Kuwait, the Bidoon. The response to the pandemic in Kuwait has presented some within the stateless Bidoon population with an unexpected opportunity for civic engagement as they've stepped forward as healthcare volunteers. This has further allowed for public recognition of their selfless national duty, given that official government rhetoric has long questioned the Bidoon's loyalty to the state. So while the Bidoon are generally unable to access public healthcare in Kuwait, when the Ministry of Interior called for unpaid volunteers to join the frontline medical response to COVID-19 in mid-March, a remarkable number of stateless medical doctors and nurses signed up. And their dedication to respond to the current national needs has garnered praise from Kuwaiti society, generating in calls for them being rewarded for this by naturalization, so by acquiring Kuwaiti nationality. As such, these medical professionals have actually emerged from the crisis as strong advocates on behalf of their wider community of excluded Bidun, and their actions moreover serve to counter the social stigma and the suspicion that the state has often perpetuated surrounding the statelessness problem it refuses to resolve. So even if the situation certainly needs us to recognize the stateless, demand their protection, resource activists who are working against all odds to make a difference, and listen to stateless people and be accountable to them. It is also, the situation is also presenting unexpected opportunities really to address statelessness. And I'll end on that. Thank you so much.
Terrific, thank you very much. That was really, really interesting. And again, it shows the connections between different areas. I have to admit, the significance of statelessness was lost on me until the Rohingya crisis, at which point it was spelt out and was made very clear just how many other rights are undermined or stripped away if you are no longer, or if you've never indeed ever been the citizen of a state, and that kind of catch-22 situation with the knock-on effect. I actually didn't know until you mentioned it today that the number was so high of 50 million around the world. Just one quick question has come in, and that's from Tanya, who's asking about the Palestinian connection, that as far as she's concerned, Palestinians have been stateless for so long that it seems to have become the norm. Is that part of your analysis?
Yeah, so indeed, Palestinians are also stateless. One of the issues with the Palestinians is that they fall under a different protection mandate of the UN, and not under the 1954 Convention relating to the status of stateless persons. But it is a protracted situation of statelessness, the Palestinian question, and I can imagine that many Palestinians who are actually staying, for instance, in refugee camps in Jordan are also facing some of the severe consequences of this global pandemic.
Mm-hmm. Yeah, absolutely. And certainly the situation in the occupied Palestinian territories and in the Cox's Bazar area for the Rohingya in terms of living conditions and social distancing is a huge worry.
Yeah.
We have plenty of opportunity to discuss that later. By the way, if you have questions for the earlier speakers, please don't discriminate against them or just respond to the most recent. Take a note of those questions so we can have a more inclusive discussion. But our final speaker now is Rebecca Crozier, who's Regional Director for Europe and Middle East North Africa with International Alert, which has a very, very long history of working on peace building and conflict analysis. And Rebecca's also written an interesting blog. We should actually try and put some of the websites and blog addresses and things might be circulated via chat if anybody has a free few fingers. But Rebecca, can you make your contribution now?
Yeah, thanks Walt, and thanks for having me. It's great to be here to speak to you all. The previous speakers have spoken a lot about the impact of conflict, of COVID-19 on conflict and vice versa. And I don't have a lot to add to that. I won't repeat what they've said. What I wanted to focus on instead is looking at how we as either practitioners, academics or others adapt to address COVID-19 in fragile and conflict affected states. As peace builders, humanitarians, development agencies, etc. There's already a lot going on in these countries and has been kind of for a long, long time, both by international organizations and local civil society. And you know, I think one of the earlier speakers mentioned the kind of networks and structures that already exist. So we've been doing a lot of thinking as an organization as how we adapt, how we use those existing structures, how we use the infrastructure that we have to address some of the issues and problems that have been raised today. I've got kind of four ideas, four things that we came up with that I will just talk you through briefly. The first is evidence and information. and getting that out to people. The second is conflict sensitive aid. Caitriona mentioned that as well. The third is countering divisive narratives, and the fourth is improving trust between states and citizens. So firstly, on the context analysis, just to start with that, so on improving the evidence and the information that is available about the impact of COVID-19 on conflict dynamics. Now, the issue here is that the impact and the effect that COVID-19 has on conflict will differ from country to country and from community to community, and dependent on gender and on other identity markers as well. I think Caitriona said in the beginning that about the localization of conflict, and therefore it's essential that we have kind of very locally nuanced analysis about the impact of COVID on conflict. There's a lot of really good kind of global analysis out there already, national level analysis provided by the likes of Crisis Group and Carnegie and so on. I think as peace builders, as people who have a presence on the ground in a lot of these countries, established partnerships and networks, and an understanding of the kind of historical trajectory of conflict in these areas, we have a really important role to play in bringing that local analysis in order that it can inform locally relevant responses, both in the immediate term to COVID-19 and in the longer term as well to some of the more downstream impacts of this crisis, economic, political, social, and so on. Now, of course, we need to really improve then our kind of methodological capacity as well, partnering with tech companies, for example, in order to get access and get the data that we need where we can't physically, particularly at the moment, be physically present in communities, but also longer term we really need to think about our kind of ways of working, and partnering more with academic sectors as well, more partnerships between academia and development, humanitarian, peace building organizations, for the kind of rigor of that information. The second area, so conflict sensitivity of aid, or aid that is sensitive and responsive to the political and social contexts in fragile and conflict affected states. Now, I think IRC just this week released a statement saying that they've looked at the World Health Organization data and Imperial College data, and they are anticipating about 3.2 million deaths in fragile and conflict affected states from COVID-19. So it just demonstrates the kind of the increased need for aid, both in the immediate term and then in the longer term as well, as livelihoods are impacted and more people are dependent on aid. So there's a real effort to kind of ramp up the kind of humanitarian response. But as we know, kind of historically, humanitarian aid that is delivered without kind of taking into account the nuances and the sensitivities of a context, and particularly conflict context, as Dominic outlined there, it's an incredibly complex, often incredibly complex contexts to work in. There's a potential then that aid could exacerbate tensions, deepen existing divides, or even, we have seen in the past lead directly to violence. But the good thing is there's a huge, there's a wealth of information out there about what it means to work conflict sensitively. There's a whole load of organizations, including international, that have been working on that for decades, and a lot of knowledge out there. So there's a need for increased partnerships between humanitarian peace building organizations, or between kind of those who have expertise in delivering aid and those who have expertise in conflict and peace building. And in order so first of all, aid does no harm, but also that you deliver aid in a way that bridges divides and brings people together. So we've been working in Lebanon with a healthcare providing organization for about 4 years now, providing them with conflict analysis, helping their staff, their frontline healthcare workers, deal with conflict in the waiting room, for example, improving communication skills. But also delivering services in a way that brings people together. So the context in Lebanon, it's been for a long time the issue of tensions between Syrian refugees and Lebanese host communities. So if you're delivering a maternal health care awareness session, for example, how do you do it for Syrian and Lebanese women together in a way that brings people together and maybe breaks down images of the other and stereotypes. And we know from that organisation that we've been working with that in their immediate crisis response now in relation to COVID-19, they have, because of the analysis that they've got and because of the work that they've done with us, they're better able to target, they've got better access to some very difficult to reach communities like informal settlements of refugees, for example, and better networks through which to relay public health information. So in the third area, countering divisive narratives. So, everybody's spoken about the COVID-19 crisis exacerbating existing tensions, increasing kind of the othering of already marginalized or vulnerable populations, whether that's refugee or displaced communities, or particularly socially or economically marginalized groups. Again, the idea that the kind of divisive narratives is not is a kind of common feature of a lot of conflicts, and is therefore something that a lot of organisations have been working on directly for a long time. So there is a level of expertise out there that could be mobilised, doing things, for example, like working with media, so with the formal media, journalists, etc., media houses. Looking at the conflict sensitivity of journalism, so the way in which you report on a story and how that can potentially, has the potential to unwittingly lead to increased tensions or inflame violence within a community. And then working with journalists to look at how you report stories in a way that doesn't do that doesn't do harm, but also then can also promote alternative narratives, more peaceful narratives, break down stereotypes of other groups. And then also giving communities or giving people the opportunity to tell their own stories, and kind of removing the power of others to tell stories for them. And that way kind of destigmatizing or breaking down stereotypes again. Again, similar with the analysis and the research, I think we do need to get better at doing this online. At the moment, there are organizations, there's an organization called Build Up, for example, which is a peace building organization that's got very specialist expertise in technology and social media. And, needing to partner with organizations like that have got a lot of expertise at countering divisive narratives online. So, for example, looking at Twitter and Facebook and the polarization of narratives there, and using that more within our own work as peace builders and practitioners. And then finally, the fourth area, so building or strengthening the trust between citizens and the state. Now, this is going to be the kind of probably the biggest area of work, I think, over the long term in relation to the impacts of COVID-19 on conflict, because it relates to the initial public health response and how states deal with that, and how the legitimacy of a state affects its ability to deal with public health crisis. And how a state's dealing with a public health crisis affects its legitimacy. But then there are longer term issues. Caitriona raised questions around the relationship between security forces and citizens, and how that's being shifted by COVID-19 and by kind of heavily securitized responses in some contexts. And then obviously speakers also raised the long-term economic impacts of the pandemic, global pandemic, and the global kind of economic decline that we already are seeing. So all of these things will shift the nature of the relationship between the citizen and state, that social contract, and it will shift the nature of the demands that citizens have of their state, and in many cases it will increase that level of demand as well for jobs, either job security or some form of income protection and so on. So I think here civil society organisations, again at all levels, local, national and international, already play a role in conflict contexts in giving people constructive channels through which to voice their demand, and that will become increasingly important in the coming months and years. And to facilitate states and citizens working together to identify problems and address them, both within public health and again broader. Something that we're looking at, for example, an idea we're working on in Tunisia is about connecting doctors that work in hospitals in very historically marginalized areas. So for example, the border regions with the Libyan border and the Algerian border, and doctors that are working in much more well provided for hospitals in urban centres or on the coast. And connecting those together so that the doctors in the kind of underserved, understaffed hospitals can connect more with specialists through an online platform, and therefore get more support and improving healthcare provision, therefore down in those marginalised areas. But also building a network of doctors that can highlight the need for improved healthcare for everybody, more inclusive healthcare, and improved healthcare, particularly in marginalised regions, and therefore, you know, use that as a way of increasing the dialogue between states and citizens on what's needed in order to facilitate a peaceful transition long term in Tunisia. You know, and then finally the kind of role of civil society holding state to account. You know, Caitroina spoke about the hard security responses undermining the long-term security and long-term stability in particular areas. And I think that's a key example of where civil society can highlight these kinds of contradictions. You know, you're purchasing the short-term security of the state at the long-term security of its safety and security of its people in many cases. So that I think is something else that we have experience of doing, I think, as a sector, and will become increasingly important in the post-COVID world. So yeah, so not to talk too much because I know we're a little bit out of time, but just to kind of recap there's kind of 4 areas: the evidence and information gathering, and particularly making sure that that's locally informed, locally nuanced, and then leads to more locally relevant responses. Supporting conflict sensitive aid and supporting particular humanitarian agencies to deliver aid conflict sensitively through partnering with them, providing advice and so on. Countering divisive narratives, both online and offline, to kind of counter this othering of marginalized groups, increased stigmatization that can then lead to greater tensions and exacerbate existing conflict dynamics. And finally, improving the trust between states and its people, and the ability of people to hold states to account, and a big kind of body of work for us there, I think, in the long term. And that's it from me.
Terrific, thank you. Thank you very much, Rebecca. I mean, some really interesting points there, and you know, all that has been learned about conflict sensitivity, and as you say, there is a wealth of information out there, is even more relevant and important now as we try and consider especially the effects of othering and stigma, which have been mentioned by a lot of the other speakers as well. We have a few questions coming in already on chat. We have, I think, about 30 minutes left. We still have more than 60 people present, which is great that everybody has stayed. It's certainly a testament to the speakers on the importance of the topic. So maybe let's see if we can do this by voice. If people would like to chip in, the number of people have asked questions already by chat. If any of those who've asked on chat already would like to chip in by video, if not, we'll try and include them here. One thing I just had to try and kick things off while people want to chip in is for whoever wants to address it, and we'll take maybe 2 or 3 questions together and put them to the panel. The importance of trying to, and indeed the opportunities for involving communities as an opportunity for empowerment, for making sure that programs are relevant, for making sure that there's buy-in. A lot has been learned, sometimes the hard way, I think, particularly through the Ebola crisis. I don't know if any of the speakers have any comments on that. And one other question that came in from Paula, and it's directed in particular to Dom and to Caia, about the need for rethinking. If you have your chat open, you can read that yourself. It came in at 2:14. The need to rethink what kind of labour is important in our societies. And probably the only labour that we can't live without is the labour around care and reproductive work, which women traditionally carry out. And just asking further about any recommendations that the organisations might have. You can see that, that question in chat yourself. And we also have another question from Bassam directed at Caitriona. As Dom mentioned, localised conflicts have decreased due to the virus, and perhaps because of having this shared and common enemy. How do you think this might improve our understanding of localised conflicts and possibly peace building? That's a big question there. So those are two or three to start off, and I'm just wondering if there's anybody else wants to chip in by voice. No, okay. Well, but I think what I'll do is I might just go through the speakers in order that you spoke. If you don't have anything to add, that's fine, and you may also want to respond to each other. So maybe turning to Caitriona first.
Thank you so much, and thank you for that question. I'll be brief, but I'll say in terms of localized conflict, I mean, I think there's a risk that it could increase in certain contexts as tensions flare up. So, you know, that's going to be very context specific, but we don't know for certain that this is going to definitely reduce localized conflicts. What I think it provides with, say, things like the global call for a ceasefire is that potentially where kind of there has been some progress in establishing peace, this might provide an opportunity, a welcome opportunity by those who want to sort of leverage and take advantage of that as well, and say, okay, this is a window for us to formalize some peace. And so I think that's really significant. In terms of what it shows us about local conflicts, though, I think it will, in some cases, cast a spotlight on how important those localized dynamics are, precisely because, as Rebecca mentioned, we need those localized responses. So we'll start to see perhaps better and appreciate better the work that many people have done for a long time, highlighting how important nuanced and contextually specific responses are in context-specific conflicts. Because I think we will see, if we don't take those into account, the responses just won't work. And so in a sense, it might cast a helpful spotlight on just how important it is to be sensitive to those divisions and those dynamics. And that might be some kind of an opportunity for just enhancing the focus on those. I just want to say briefly to the question about empowering communities, I think there's also, you know, loath as we are to say that this is an opportunity, there are ways to start rethinking about how we've worked. And as Rebecca mentioned, kind of thinking about new ways of working, as Don mentioned, adapting responses as well. So there might be opportunities to say, you know, frontline responders, humanitarian responders, and local responders are going to be a much more vital part of humanitarian response, even than they have been to date. And so thinking about what that means for the humanitarian system as well as a whole, partnership and ways of working with, whether it's refugee-led organizations or with community-led organizations, there might be opportunities as well there to think about how those relationships shift and how they can change in ways that really do empower kind of meaningful and equitable partnership, if and where that hasn't necessarily filtered down to those organizations yet.
Okay, terrific. Thanks very much. Dom, you're still with us, I think, in Beirut.
I am, yep. So I'd like, first of all, I'll just talk about the question about community. Our interaction with community is a fundamental foundation to all of the work that we do. We have to consult with community members to make sure that what we do is correct. We need to have feedback mechanisms in place to understand whether we continue to do things correctly or not, and to allow for people to complain and to raise their voices if we are not doing as well as we could or should. So this idea of community consultation and having this constant dialogue is fundamentally important. And when we're talking about people who are extremely vulnerable and that their vulnerabilities are very specific, and let's say, for example, you know, a female-headed household who has, you know, huge challenges getting money and living in a displacement camp, you know, these huge vulnerabilities, we cannot hope to understand their specific vulnerabilities or what to do about this without having them you know, continually engaged in conversation with them. In Ebola, we learned that passing messages around how to protect yourself from getting the disease was best done by actually having the community share the messages themselves. So we would identify a couple of focal points and make sure that the messages that need to be passed are understood. They would then put it into locally specific, you know, locally appropriate language, and to go around and spread the community, because people trust each other in communities, but they don't necessarily trust outsiders. So this, you know, this concept of trust is, of course, fundamentally important. Coming to the question of women and women's role in society and the importance of women's role in society. I mean, Paolo, I fully agree that women's role in society is extremely important, and we really do have a spotlight on them at the moment. But it's not only on women, it's also, for example, on waste disposal systems in cities, which have to continue collecting the rubbish, or food production. And, you know, at the moment in Europe, we have this issue of the difficulty of finding people to take the harvest in, and the consequences of that on our access to fresh food. So there are lots and lots of parts of our society which are not necessarily valued, but are now increasingly becoming super clear as being fundamentally important to society's existence. Now, women, of course, are definitely one of those groups. Now, Concern has always recognised the importance of women, and also that women have specific vulnerabilities that need to be understood and focused on specifically. 70% of health workers globally are female, and so, you know, at the moment it's women who are at the front line of the COVID-19 response, and that shouldn't be forgotten. We therefore need to, you know, recognising their vulnerability, recognising their importance, they have to be central in the way that we respond. So we need to, for example, make sure that there are support services which are female specific, that are responding to some of these specific risks that women face, like an increase in GBV that I mentioned in my presentation, and the importance of having universal healthcare, which is given equally to everybody. One of the consequences of Ebola was a massive increase in maternal mortality, because women were unable to go to the health centres, partly out of fear of getting Ebola, and partly that they were actually turned away because the health service was focusing on Ebola and not on maternal health. So, you know, you trying to learn from these lessons. So my final point on this is that we're in a global recession at the moment. The longer it lasts, the more chance that this will become a global depression, which is far worse, and will have very long-lasting consequences economically across the board for everybody and in every country. And this, grim as it may be, also gives us an opportunity to really look carefully at how human societies are built and how human economies are built, and maybe try and tweak them and try and improve them and try to return to healthy societies in a way which is much, much better. And I would really like to flag two areas of which I think are fundamentally important in the economic rebuild phase, one of which is to focus on equality, and that women obviously have to be central to that, and secondly, to focus on the environment and to try and rebuild our economy in a more climate sensitive fashion.
Great, super. Caia?
Yeah, thank you. So in terms of community, throughout the work we do at the Institute of Statelessness and Inclusion, we want to be part of a global movement on statelessness. So being in touch with stateless communities themselves, with grassroots organizations, with organizations working on the ground is for us paramount, and we want to be accountable to them and work in partnership with them. I already mentioned during my presentation that we were in touch with someone in Nepal, for instance. So this is something that is part of our, has always been part of our work, and is something that we want to be doing even more of. In terms of what is needed and what consequences women are facing in particular, we definitely want to hear from the communities. As we are an NGO working at a global level, what we try to do is offer assistance, expertise, but also global visibility towards some of the issues that are that people are facing on the ground. And yeah, I mean, I was very happy to hear from Rebecca, for instance, about the importance of the local and about partnering with local partners, because that is exactly something that we are doing. What else was I wanting to say? Yeah, so there was. No, I'm going to leave it at that for now. Sorry. Yeah.
That's fine. And we'll have another round. We'll be coming back to you in a moment anyway. That's great. And finally, Rebecca, and for the next round, just to warn you all, for the next round, maybe we'll take the speakers in the reverse order so that you're not always the one at the end, Rebecca, trying to not to repeat points that were made already.
It doesn't matter. I don't mind. It gives me a chance to think. Just on the empowering communities, just one reflection actually that you know, we've seen in the Syria crisis and the Nepal earthquake. There's kind of two examples I can think of off the top of my head where local community-based organisations and local civil society were the first people there, and they were the most effective at responding to the immediate needs of communities. So I think it'd be interesting to look at with this the response to the pandemic longer term, the extent to which this helps kind of catalyse a shift that was happening anyway within the humanitarian sector to empowering and to working more with local organisations and local communities to respond, because it doesn't seem to make a huge amount of sense. You know, we continue to rely on flying people in from other countries to deliver aid. If there are structures already there on the ground. I think the sector, the kind of humanitarian kind of machinery hasn't yet caught up with exactly how to transition from using big, huge organizations and flying people in and out to using what's already there on the ground. But I wonder whether this pandemic and the response to it will kind of help kind of catalyze some more discussions there, particularly when it's so physically difficult for people to come in and out of countries at the moment. On women's roles and women's groups, so just one point to say, we did some research a couple of years ago with Oxfam, which I found quite interesting, in the MENA region, and we spoke to women's organisations and gender justice groups, and consistently what they told us throughout those contexts was that in the context of crisis, and this is in the conflict crisis, they were consistently told, both by governments and people within their own country and by NGOs, that now is not the time to push for gender equality. Now is not the time for your advocacy, etc. What you need to do now is respond to this immediate crisis. And you know, particularly INGOs are using or pushing kind of women's networks because they've got the access, because they've got the legitimacy within communities to deliver aid, to deliver humanitarian aid, which is fine and important, but that was at the expense of the work that they were doing to highlight and address more structural issues of gender equality within societies. So I think it'd be interesting to kind of keep an eye on the extent to which that happens with the COVID-19 response, and ensure that we're protecting that space for organisations that are advocating for the more structural kind of issues within a society to be addressed. I think just one point on Lebanon, there was a question to Lebanon, it was more kind of directed to Dominic, but I think just to highlight that the situation in Lebanon is a kind of, you know, the result of a long kind of history of poor governance, corruption, and so on, and you know, and is to do with the Lebanon's own conflict not really being essentially resolved, more frozen rather than resolved. And so I think what we will, you know, COVID-19 has kind of exacerbated it in the sense of the lockdown harming people's ability to make a living, particularly the kind of the most marginalized in societies. But I think, you know, Lebanon urgently needs a kind of economic support from the outside, and the extent to which that'll be affected by the global recession now is unsure. But you know, I think what we're seeing in Lebanon is increasing public and political unrest, which isn't going to go away, an increasing demand for a state to be responsible and accountable. That's not going away with the current crisis. So I think we can expect things in Lebanon to potentially to get worse, and for a need for a kind of global response to that issue. particularly with it being in a region that's already so affected by conflict.
Great, terrific. We have another few questions that have come in on chat, which people may have seen already, but if anybody wants to join with a question by voice, now is your opportunity. Okay, well, I'll just go back to some of the other questions that have come in on chat that maybe haven't been looked at already, and just trying to take them chronologically. Tanya, I know that Rebecca just referred to this. Tanya has a question for Dom in particular, saying, can you elaborate on how the government is using this lockdown for controlling dissent, and how do you see that situation unfolding across the country? And I can't remember which of the speakers, I think it was you, Dom, mentioned the Arab Spring and the way all of these things one thing can be a trigger for another. So that's that one. And then we also had a question from Rohit to any of the speakers saying, what will be the structured or unstructured changes in societies by governments in their countries? What speculation do you have? I think the whole question of social capital is fascinating, which I know Caitriona mentioned in the first presentation, the trust, social cohesion, all of that, but also how social capital can be positive in a conflict or crisis situation, how some social capital is destroyed, some of that trust on those networks and those norms, some gets kind of distorted, and some new social capital is created as well as an opportunity, which some of the other speakers have referred to. And then Chloe is also, sorry, I think it's Xenia, is saying, does any of the speakers have thoughts on Turkey's drilling for gas in the Mediterranean during the pandemic, while the country is dealing with the pandemic at home? It seems like they're taking up the opportunity now, which may increase indirect conflict, while other interested countries in the region are preoccupied with the virus. And also then, Chloe, again, for whoever wants to address this, and I know that Don mentioned Somalia, any specific immediate concerns about state building, considering that airspace is closed and in-person meetings aren't possible? I know this was mentioned by one of the speakers, that peace building itself, along with the humanitarian response, that in itself is actually undermined. So again, if the speakers would, maybe we'll go in reverse order with Rebecca first, just so that you're not left at the end.
Yeah, okay, so on the state building question, or you know, what can happen more generally whilst people physically can't move in and out. I mean, from my own point of view, my organisation, there is actually quite a lot happening anyway. It's just all been moved online. So there's a lot of you know, existing dialogue processes that are continuing. You know, we're being asked in some cases, so you know, the government of Mali asked us to continue the dialogue we were doing between the security forces and citizens there, because of the importance of it in the current context. So that's still happening, mostly online. I think where a huge amount of our work, we're actually just discovering now can be done remotely, but where I think we're going to struggle is when the topic of this is a very, very sensitive issue, and where we are bringing groups together that have not yet met physically. That's where we are as an organisation on what can be done remotely and what can't. Because it's one thing to move an existing process where there's a level of trust has been built, and moving that online is one thing. Bringing people completely cold to an online dialogue where you yourself, you know, we're all still learning about the ins and outs of facilitating these types of processes remotely. And within our sector as well, the type of work that we do, there's so much importance rightly given to the ability to look someone in the eye. A lot of peace building is very human. It's very much about human interaction. And that's not quite the same online. You can't have a cup of tea together. You can't sit down and have a meal. You can't look someone in the face. So so we're still working that one out, to be honest. But I think just to say that we've surprised ourselves as to how much has been able to go online. I think out of the questions, that was the only one that had a kind of. I don't really know anything about Turkey's drilling for gas, so I won't try and answer that.
That's great. Thanks very much, Caia.
Yeah, so a couple of points. First, maybe to echo what Rebecca's just pointed out. So one of the things we're doing with the Institute on Statelessness and Inclusion is at the moment trying to build a movement, a global movement on statelessness, for which we are now moving everything online, meaning that we're having consultations with stateless persons and grassroots organizations themselves online. However, if you really want to build a movement, if you really want to make people connect with each other, it's also very important to bring a group together in person. So that's something that is definitely a challenge at this point. But for now, most things are able to continue online as normal, almost, so to say. Because we were already an organization that was working a lot online. So in that sense, we were kind of lucky that we already knew Zoom and that kind of stuff. About the changes in society that this global pandemic might bring about, and especially about the trust aspect of that. Obviously, if you look from the perspective of stateless persons, they are often already considered not to be part of a society or of the country where they live, either because they are not recognized as citizens of the country, or because they have fled there and have continued to live there legally or illegally on the margins of society. But so the natural thing would be that there's a lot of distrust against these groups, because there's already distrust, and in these kinds of situations that would only grow. However, the example that I mentioned of the Bidoon, where these people are stepping up as volunteer nurses and volunteer doctors, shows that it can also have a different effect, where trust is actually created, and that could potentially also have positive consequences for the inclusion of these people into society. So in that sense, I think that the pandemic presents definite concerns for society and what it looks like, but there's also opportunity there. So I think we should definitely be looking at both sides of that. But it's obviously very difficult to predict what will actually happen. One other thing with regard to how governments are using COVID-19 to impose all kinds of measures, lockdown, etc. One thing that I wanted to mention is what we've seen is that countries are sometimes abusing really their powers to start tracking people, for instance. So what we've heard from India is that they've started to actually track people who are Rohingya over COVID-19 concerns, but actually they are already not very happy with them being in the country and would really like to deport them. So it's something that they would already are not very happy with, and now with COVID-19, they actually use that as an opportunity to start tracking these people actively. So you do see that states are using the situation in a way that is not necessarily for the better. I'll leave it at that.
Great, super. Tom?
Okay, so let me just speak a little bit more about Lebanon then. So I'm extremely worried about Lebanon, and I have flagged it as being one of the countries of deep concern with regards to returning to the conflict or some form of conflict. So we have the worst economic crisis since the end of the Second World War. At the same time, we have widespread popular protests, and then we have COVID-19. So the lockdown, in some ways, took the wind out of the sails of the protests, in that the protests were no longer on the street and visible, but they did migrate to an online. And so the conversation has continued online. As soon, and also during this last lockdown period, the new government has been meeting, And they have been discussing, for example, some form of social protection assistance to people. The social protection that has been given the green light has been done by the army, with obvious issues there, but also that it's been delayed, that the amount of money has not been is not really high enough. There's been questions around targeting. So, you know, this stuff goes backwards and forwards. The last parliamentary session, they concluded that they would give a bailout to private hospitals, but when the subject of how the most vulnerable people in Lebanon are going to be supported by the government, they ran out of time and had to close the session. So, I mean, it's things like this that really worry me. So, I mean, we saw at the weekend that people are now back on the streets again, that they are just starting to defy lockdown. And also, as lockdown measures are slightly being relaxed, people are going, okay, enough, and they're back on the streets. And it is more violent now. Now, so there's these three different elements of, you know, the economic crisis, the COVID-19 and the protests that are really cause for concern. And balancing that, though, is that the protests have, maybe arguably for the first time since the Civil War, built a common or shared identity amongst Lebanese people. And I think that this might be their saving grace. So I can't say for sure, look, I think it's going to go to conflict, because I do think that there is now a shared sense of being Lebanese and of being in it together. And hopefully that will be enough to tide them through. I'm a bit pessimistic, but I'm crossing my fingers.
Great, interesting. Yeah, that whole question of identity, and when there's a sense of a kind of a common enemy, does it make people bond together or turn against each other, is a really interesting one, especially in terms of othering. And so finally to Caitriona, and I think this will probably be our last contribution since we're just coming up to the hour. So Caitriona going last instead of first this time.
Thank you so much. I'll speak really briefly. I just want to flag 2 points. One is, you know, I think it's great that we all celebrate the ability that we have, and this is an example of it, to move online. I think something that is going to be on the horizon and hasn't been part of these discussions yet so much is data privacy and security of those sorts of online platforms. People in conflict-affected contexts have every reason, legitimate reason, to be apprehensive, to be concerned, to suspect that their data or information about them could be misused. So we have to take that seriously, and I think the humanitarian sector, there's going to be, where there is partnerships with tech, it will be interesting to see how can we make sure we're doing that in an ethical and a protected and a safe way that takes those concerns that are legitimate and well-founded very seriously. Secondly, I think the point I wanted to just echo in terms of Rebecca's comment, you know, this idea that people are told now is not the time to deal with these structural issues, and I think it goes to the question by Rahit about, you know, what will those structural changes be? I think that really depends, and we can see this as the tragedy that it is, but also as the opportunity to say this has cast a spotlight on public health as a global issue and as a global resource, and something that we must invest in, and that we can push not just for supporting communities in conflict-affected contexts, but also, you know, member states all over the world. Some of these decisions are playing out in places like the Security Council about the allocation of humanitarian assistance, about the access and unimpeded access of humanitarian actors. Those decisions are in part political. And for those of us who are sitting in Dublin, Ireland's currently bidding for a seat on the Security Council. So I think those kinds of considerations, how can we see this as an opportunity also to say, actually now is the time to talk about migration, to talk about displacement, to talk about our commitment under the Global Refugee Compact or Women, Peace and Security, not because those structural issues are secondary to COVID, but because COVID has cast a spotlight on precisely those vulnerabilities and reminded us how important those public goods writ large are. So I think there is that opportunity also, and that structural change could come out of this terrible situation.
Mm-hmm. Okay, really interesting, and I'm kind of provoked by your comments there to think about how have we responded when there have been other opportunities, like, you know, the financial crisis, when people of, you know, 2007, 2008, when people were saying we really must rethink the entire financial system, which certainly didn't happen as a result. I know there was changes in regulation and changes in the way people think about markets and finance, but there weren't those underlying changes that I think a lot of people were looking to. And also in this context, how do we get the attention of decision makers and policy implementers. For you know, when we have advocacy messages, how do we get their attention, since there's so much going on, and there's you know, the reason can always be used, as one of the contributors said, yes, we'll deal with that later after we've got out of the crisis. So we're just coming up to the hour, and we said we'd run it for the 2 hours. So I'll take a steer from the organisers if they want to say anything to me by chat or verbally. I think maybe this might be the moment to wrap it up, or the organisers can also have the option of leaving the meeting room open if people want to continue with chat in whatever form. The fact that we have 50 people still online 2 hours later is a credit to the speakers and the way you all interacted with each other, which was so nice. So I'm just going to hand over finally to Nitika, who wants to thank the speakers formally. And can I just give my thanks to everybody who contributed. Fascinating. I can't say I'm leaving with a lot more hope, but some people were able to point out some opportunities, which I think are very positive.
Thank you, Walt. So yeah, I want to thank all the speakers. Thank you, Caitroina, for joining from Dublin. We have Caia joining from Netherlands, Tom joining from I'm sorry, I forgot, Lebanon, exactly. And Rebecca joining from UK. You all have given us so much to think about. We all are more informed. And I also want to thank Walt for being Walt. Thank you for graciously and effortlessly chairing this panel. Thank you for joining.